And this evening, we're going to go through all of it from wholesale to retail. We're going to give you all the pertinent information that you need because we know that the vaccine, we're on the cusp of starting the distribution of the vaccine here in Jamaica, land we love. I'm going to be your hostess for the evening. I am Kadeen, Miss Kitty Hilton, and we want to just thank everyone for being here this evening. Our Minister of Health and Wellness would have announced on Tuesday that Jamaica is expected to receive the first shipment of COVID-19 vaccines, AstraZeneca, and in short order will be distributed to frontlines of the public who have submitted their questions online and to our media partners on Zoom, and all who will be here to pose their questions later to my esteemed panelists who I have the pleasure of introducing now. Firstly, we have Dr. the Honorable Christopher Tufton, MP, our Minister of Health and Wellness. Dr. Jacqueline Bisesa Mackenzie, Chief Medical Officer. Professor J. Peter Figueroa, who is on Zoom, Head of the Caribbean Technical Advisory Group on Immunization, CTAG, and Dr. Melody Ennis, who is also joining us via Zoom, and she is the Director of Family Health Services at the Ministry of Health and Wellness. Thank you, and we will move right into opening remarks from our panelists, and we'll start with Dr. Tufton this evening. Minister, tell us again where we are with the vaccine and the deployment of same, as well as the bilateral arrangements.
First of all, I did not know until just a while ago that you were Kadeen, Miss Kitty Hilton.
Yes,
I know
sir.
about Miss Kitty. Anyway, thank you very much for that question.
At official functions like this, you have to bring in the government name.
And good evening to our viewers, and thank you all for being here, especially our special guest, Prof. Figueroa. Well, we are making progress as a government. I'm happy to say, with the hard work of the team, some of whom are here with us, we have been able to secure, based on our COVAX facility, which is a WHO PAHO organized pooling of funds to access vaccines to ensure that all the countries, 166 I believe in that facility, access vaccines once those vaccines are available. I announced in Parliament that we would have between the middle to the end of this month between 146,000 doses, possibly up to 250,000 doses. And if you assume 2 doses per person, you're looking at the possibility of 125,000 Jamaicans. In addition to that, we're pursuing avenues through CARICOM to access an additional 500,000 doses. That is still yet to be finalized. And we are discussing with a number of countries, China, the UK through AstraZeneca, Oxford. We're looking at Mexico and a few others, Cuba, to see to what extent we can add additional doses for the population. Right now, what we're doing is trying to prepare, because now that we know that we will have the vaccine, the issue is how do we prepare the public to appreciate the value of having the vaccine as a critical response to COVID, to overcome some of the challenges, the fear, and the government is committed to doing that, and we will be doing more of it in the weeks and months ahead.
Very well. I turn my attention to the Chief Medical Officer, Mrs. Jacqueline Bisesa Mackenzie. CMO, Jamaica has been vaccinating for a long time as part of our public health response. Tell us what has been the relationship between vaccines and public
of immunization in 1978, where all children going into school are required to have a vaccine. This was supported by legislation in 1986, where we had the public health immunization regulations that now gave some teeth to the policy that we had. So we've had a very good history of immunization, such that we eliminated polio in 1982, measles in 1991, and rubella in 2000, with the last case of congenital rubella being in 1998. So now we vaccinate against, I think it's 11 or 12 diseases. We recently introduced the HPV vaccine in schools. And this is a program that is well embedded in our public health program. It has benefited us as a country well. I mean, I know persons who have polio, who were born in the 1960s, and it is very good when we can look back now and say that we have had no cases of polio. I mean, I know persons who have had rubella, and with disastrous outcomes to their children. to the unborn child and to children that are born with problems. So therefore, it is a very good thing that we can offer vaccination to the public, very, very useful vaccination right across the world. So this now is a new vaccine that is going to offer us an end to some of the horrors that we're going through with COVID-19. So we welcome this, and we would encourage everybody that wants the opportunities there to take the vaccine, to take the vaccine.
Absolutely. So Jamaica, though COVID-19, the vaccine is new, Jamaica isn't new to getting vaccines. Right. So it's not the first time. Very well. Thank you so much, Doc. Let's turn to Dr. Melody Ennis, the Director of Family Health Services at the Ministry of Health and Wellness. Doc, welcome. Good evening. How are you? Dr. Ennis? I'm seeing Dr. Figueroa, so I'll just go and speak with him in the meantime. Dr. Figueroa, good evening. How are you? I'm reading your lips, and you said you're fine and you look fine. Thank you so much for joining us this evening.
Okay, I'm now unmuted.
Very well, very well. We're hearing you loud and clear, Prof. Thank you so much. Doc, from a global and regional perspective, can you tell us what has been the view on vaccination?
Well, you know, the Caribbean has actually led the globe in relation to the elimination of childhood diseases. So our people are accustomed to vaccination, and as the Chief Medical Officer said, vaccination is the most cost-effective measure in public health. So the majority of people certainly recognize the need with a disease like COVID, where there have been over 2 million deaths globally and over 350 deaths in Jamaica. The vaccine trials have shown they have been taking place on all continents, and we have now in trials tested the vaccine in hundreds of thousands of people. And in the United States alone, over 33 million people have received the vaccine. And these vaccines are extremely safe and highly effective. When you look at the trials and you look at the persons who were vaccinated, there were virtually no persons admitted to hospital due to COVID among persons who were vaccinated. So this is a huge opportunity for us in Jamaica. The vaccine has already reached the Caribbean and has been given in the Cayman Islands, Bermuda, Turks and Caicos. The same vaccine we are getting has now arrived in Montserrat, British Virgin Islands, and Anguilla. So I think all of us should prepare ourselves, and when our turn comes, certainly step forward and get vaccinated.
Very well. Thank you so much, Prof. I turn to Dr. Ennis. Good evening, Doc.
Good evening, good evening. Thank you so very much.
Thank you so much for being here, Doc. And, you know, it's great to have all hands on deck to disseminate information so we can definitely cure all the queries, answer the questions, and so that people can be rest assured that the vaccination is to our benefit, it will inure to our benefit, and so we should make ourselves available. How ready are we, Doc? Because we're talking about the rollout and the distribution of a very delicate vaccine, getting people mobilized, getting the vaccine to those persons who are most vulnerable at this time. How ready are we as a nation to do so?
You know, I'm not going to put a percentage to it as yet, but I want to tell you that we are just about there. There are several factors that we have been focusing on to include our PR or demand generation. We know we have a target population in phase 1 to vaccinate, and we must increase the public awareness, the sensitization of everyone as to the benefits and the need to accept this vaccine. So we are intensifying and heightening our public awareness campaign, but we also have to manage our cold chain and logistics, because as you mentioned, These are delicate vaccines that are coming in. Fortunately for us, AstraZeneca, we are accustomed to keeping and carrying vaccines at 2 to 8, but we are managing both at the national level and at the parish, at the very granular level, to ensure that once the vaccines get here, they remain efficacious. Our cold chain is maintained. Our personnel on the ground have the requisite equipment to manage and care the vaccines. And then, of course, we move into the business of service delivery at the sites that we will be vaccinating from. We are ensuring that they have the right setting in order for us to observe patients once they have been vaccinated. We are organizing our mobile teams. So in general, I believe we are about 80% ready, and we have less than 2 weeks to go, and we are fully mobilized to meet the target of once the vaccines get here, we can begin to get it into arms.
Well, that sounds quite impressive, Dr. Ennis, and we're looking forward to that. And I'm quite sure all of our viewers and listeners are also impressed with those numbers. But Doc, Tufton, you know, when it comes to the numbers, we want the results and want to, you know, to ensure that we get them up. But you, sir, you conducted a poll on your social media pages recently to look at the results of what was the poll all about, and what empirical data or what data did you gather from those polls?
Well, first of all, I want to thank my Twitter and Instagram followers. Not as many as you, of course, Miss Kitty, but nevertheless, normally persons who are interested in public health issues.
Yes.
And so we basically said to them, what are your opinion on this vaccine? Are you prepared to take? And what are some of the concerns or questions that you have? And the results led to a number of questions, which is going to come up on the screen, some of those questions, because
yes.
I think it's important that we respond to the questions that are being asked. We asked, would you be willing to take the AstraZeneca vaccine? 134 votes for yes, 207 votes for no. Mm-hmm. That was concerning.
Yes.
Because this is a microcosm of a larger population. And what you have there is that a number of persons are concerned. Now, the no's weren't necessarily, no, we will never take it. Mm-hmm. The no's, to my mind, based on the questions that were posed, suggest a pause and a need for more information. Mm-hmm. And this is why an exercise like this is so important. So if yes, we said why, and we had questions like, I prefer to take my chances with the vaccine than take chances with COVID.
Yes.
And that's a very powerful statement. The truth is, the vaccine is going to offer you far more protection than you're saying that you will do it on your own. You have questions like prevent burdening the healthcare system, which is a big issue if people have to be hospitalized. Need to be able to start living without fear and worry, a big issue of return to normalcy. And just another one, well, this is a very enthusiastic supporter who said, I will be the first in line when I'm eligible.
Yes,
so
me too.
We have had very positive feedback from the yeses.
Yes.
The issue now, Miss Kitty, is how do we deal with the no's?
The no's, yes.
And
bring them over.
And the queries around the no's. Do we have some questions as to why the no's? There's one person who said, and this is Paula 28 underscore M's, and her response is that it needs more testing to be deemed safe.
Yes.
That's an important question that I think needs clarity. I will wait a bit more to see if it is effective on other Jamaicans. I want to see or get information on clinical trials. I leave that to the experts and to you to figure out why those questions are being asked and what are the best responses to those questions.
Well, I had on my show on Nationwide 90 FM, Miss Kitty Live, we asked some of these same questions. I had the honor of having Dr. Ennis on my show as well, and some of the concerns regarding how did Jamaica decide to choose AstraZeneca over Moderna or even the Pfizer drug? What was the turning point that made us decide to go with that particular drug? What are the tests that have been done in that regard? How safe it is? And of course, persons wanted to know whether you're going to take the vaccine, if the Honorable Prime Minister is going to take the vaccine, and other members of Parliament or the government is going to take it. So those were some of the questions and queries that they had as to whether pregnant women can take it, because different vaccines come with different rules or restrictions. And so persons asked those questions. But I wanted to go now to the Slido questions, because persons would have submitted some of their questions and their queries. And I will throw them out to the members of our panel. And of course, anyone who is fit enough to answer may do so. So firstly, I got this question about who is paying for the vaccine. Will it be free, or will it come at a cost to Jamaicans?
That's a policy issue, and let me say that the government has already said on record that the vaccine will be free to all Jamaicans who wish to take the vaccine. It is a choice, even though we are encouraging it. There's no law that says you have to take it. And so, yes, you will be free. You will get the vaccine at the cost of the government, and by extension, I guess, the taxpayers. The issue now becomes when you are eligible by virtue of vulnerable groups, and then the other groups that will come after, because we're giving priority to certain segments, and then we move eventually to the full population.
Very well. Dr. Bisesa Mackenzie, a question here. What is the recommendation for the vaccination of people who are immunocompromised, such as those with cancer or HIV?
All right, so the big problem we have with vaccination of those persons is when we use live vaccines. So these vaccines are not live vaccines. So that is the first thing that the population needs to bear in mind. So they are safe in persons who are immunocompromised. Important thing is that immunocompromised persons and persons with chronic diseases are the persons that are more at risk for serious illnesses. So those are the persons that we do want to become vaccinated against COVID-19. But these vaccines are safe because it's not live virus that is entering your body that has any chance of getting out of control, as what people would think.
Okay, very well. Another question here. Do persons who have caught the COVID-19 virus before and recovered, do they need to take this vaccine? And if so, why?
One thing we're not quite sure about as yet is the length of the immunity that persons have. We have seen various studies that have shown that up to 6 months we know that persons are protected from getting a second infection, but we don't have long-term data. And we also don't know the strength of the immunity in many persons. So therefore, yes, we are advocating that persons who have had COVID-19, that they should take the vaccine.
All right, because I know some people thought that because they recovered, then their bodies would have developed the antibodies, then they may not need it. So I'm happy that you were able to clarify. What is in place to address the immediacy in terms of any adverse reaction that may occur in the Jamaican population?
All right, so first of all, we want to ensure that when the delivery of the vaccine is going to be safe. And so therefore, at all our sites that we are going to be vaccinating, we will have the necessary things in place in case there are any issues that will come up. And persons will respond differently to vaccines, regardless of which vaccine it is, you know. So we will have the necessary staff in place to deal with any problems. In terms of if persons develop problems after, we do have a program for evaluating events that occur after vaccination, that we follow persons over a period of time to monitor any adverse events that occur. Now, as those are recorded and reported, then we will deal with those as indicated. In terms of whether or not there is any kind of compensation that is in place, well, we do know that there may be some countries that have a compensation package in place for persons who will have adverse events. Right. So we have not yet, we are looking at this. It is being discussed We do not have that kind of facility in place for all our vaccinations. Remember that immunization is something that we've been doing for a long time. We have not had any reason to put this in place. So far, this vaccine, as Prof had said, we have seen it being given to millions of persons. We have not seen the kind of effects that some people were expecting. It has been a very safe vaccine so far. And that is one of the things that we have to focus on, that this vaccine has been found to be safe.
Yes, Minister.
If I may, I wanted to, through you, of course, allow Prof, who actually sits on one of the expert panels at the level of both PAHO and the WHO, and reviews the data around these vaccines and essentially contributes to validating the safety of these vaccines. I think he is in a very good position, and we're proud of him, by the way, as a Jamaican, in such a high position, helping the entire world, not just Jamaica, to comment on the vaccine, because on my Instagram pages, I've gotten a lot of questions in recent days about the safety of this particular AstraZeneca vaccine, and I think it will be worthwhile through you.
Yes, sir. Your expertise is invited. Yes, Prof.
Well, there is no question that all the vaccines that have been reviewed so far are both effective and safe. So people, you know, the vaccine, the way it is made up, it's not a live vaccine. It uses what we call a vector. They take the shell of a virus, a common cold virus, adenovirus, simply to get that into the body's system and into the immune system cells. And within that, there is a mimic of the spike protein, something just made that's similar to the spike protein, that then induces in the human a response that helps to protect us against the coronavirus itself that causes the COVID disease. Now, this is technology that has been used many times in terms, so it's a traditional platform. There is no adjuvant, there is no harmful material in the vaccine, and the material in the vaccine that goes into the cells is rapidly broken down and removed by the body through normal methods. Now, how do we know it is safe? It is put in trials, thousands of persons, and what you do is you give the vaccine to some people, and you give a placebo. In other words, something that does not have the vaccine, just a simple saline injection or equivalent. And you compare the side effects, and you can see that the only side effects that we've been seeing that are of any significance are like a swollen arm, a little fever, headache, tiredness, and these usually go within 24 hours. Now, why it's so important to have this comparison group that you give the placebo is because in every population, you will find that people develop different conditions from time to time. So you can compare these conditions that arise, including severe conditions that arise in those who did not get the vaccine and those who get the vaccine. And you can see that there is a similar pattern of these conditions that arise. But in the people who get the vaccine, there are signs, the response of the body, the little fever, headache, and the local reaction tells you that the body is responding to the vaccine and developing the antibodies and the cells that protect you against the COVID.
Thank you so
all
much,
the
Prof.
studies show
Yes.
that there are very few cases of severe COVID requiring hospitalization in persons who are vaccinated. These vaccines are very effective and safe.
I thank you so much for that, Prof, because a lot of persons have asked the question, how is it that this vaccine is safe and it came about so quickly? They developed the thing so quickly. You have cancer and you have other ailments that all know they can't figure out a vaccine and they can't do anything about it. We've had this COVID-19 pandemic. We were hit with it last year, March, and all of a sudden in less than 9 months, 11 months, they concocted this vaccine. How safe is it? What do you say to that, Prof, in terms of the time span?
Remember, Kitty, do you remember in 2005?
Yes, the
when
SARS.
we had this huge global scare with SARS,
Yes.
the severe acute respiratory syndrome, when people were dying in Hong Kong and the Far East, and some cases even came to New York.
Yes.
That SARS in 2005 was caused by a coronavirus, which is a cousin to this virus, this coronavirus, that caused infected with the COVID virus. It's the PCR test that we are using. It was developed 1 week after the virus was sequenced. And those vaccines
too new. In
Yes.
fact, when you look at the questions, persons were saying, let me see how it works on other people
First.
before I take it.
Yes.
scientists who were working on the SARS vaccine now, they just took the sequence that they got from the COVID virus and changed up their vaccine work a little bit and produced candidate vaccines in weeks. And then they had to take that vaccine and put it in clinical trials, 3 different stages, in animals, in a few, say, healthy adults to make sure it was safe. And then they put it in the trials with thousands of people. And these are the results that we are hearing about.
So it's not something overnight.
It's not overnight. It is over 15 years.
I think that's such an important point, Ms. Kitty.
Yes, that's
because I get that a lot as Minister of Health whenever I go out in the countryside, when I get the calls, the tweets, the people say, listen man, this thing is just too new. In fact, when you look at the questions, persons were saying, let me see how it works on other people
first
before I take it.
Yes.
And I think the point that Prof is making, that this is from 2005, should be sufficient, and hopefully will offer some comfort to those who are doubting based on the time span.
Very salient point, and I'm very happy that you brought that to the fore, Prof. But I just wanted to ask as well, Prof, because persons are asking this question. When the COVID-19 vaccine is administered, does it mean that the person can never get COVID-19 ever again? So as I get the AstraZeneca vaccine, can I get COVID still, or am I now covered under the blanket of the vaccine?
Yeah, that's a very important question, because they've only followed up the persons with the vaccine now for maybe 6 months or so, a little longer in some instance. So we still do not know what we call the duration of protection from the vaccine. And remember, when you get the vaccine, the body has to respond to it. So if you get exposed within the next week, it means that you could still become infected. So you still have to keep on your mask, maintain physical distancing. Now, the AstraZeneca vaccine, it takes on average, I would say, 2 to 4 weeks for you to really begin to develop good immunity. And then you get your second dose after 4 to 12 weeks. And that immunity shows to be very, very good, because among the persons who have 2 doses, very few of them got the COVID, very few of them. But even after 1 dose, you could see where after a few weeks, persons were protected from COVID, but the protection was not as full as when you got the second dose. But we don't know how long it will last. They're going to follow up the patient, the persons who have got the vaccine, and identify how long the immunity lasts.
Very well. Thank you, Prof. All right, I'm going to invite some questions from the media. Stephen, we're not ready. All right, let's go back to some questions to Dr. Bisesa. In terms of priority, Doc, who are those persons who are considered vulnerable groups, those persons who are considered first in line, or who will be first in line and priority to receive this vaccine?
All right. So our main objectives for vaccination is to decrease, to allow for the health service to continue and to protect the vulnerable population. So with regards to that, our health sector workers are the first candidates that we're looking at that needs to be vaccinated. And not just to protect the healthcare worker, but also remember that there's a highest level of exposure in health facilities. And so healthcare workers being affected not just affect the health system directly, but also can cause infections of other persons as well. So it is critical that the healthcare workers are vaccinated. Then we have our vulnerable populations. We have seen globally, and as it plays out here in Jamaica as well, that our elderly population are really at risk for severe illness and have led to deaths in over 350 persons in Jamaica. So the elderly population, and we are targeting the over 60 age group here in Jamaica with our vaccination program. We also have other essential workers that we're looking at, the Jamaica Constabulary Force, the Jamaica Fire Brigade, our custom workers, of course our government ministers or parliamentarians, persons who are in senior positions within government, of course, to allow the country to be able to operate safely. So those are our priority groups. Within each group, we would have we would have as well priorities within those groups. So our healthcare workers, those that work in areas that they're more likely to be exposed, those are the first persons that are going to be vaccinated. So we have persons that are very active doing the testing, treating of persons in our accident and emergency departments, persons in our health centers that are doing a lot of work with COVID. So those as well would be first priority as well.
Okay, very well. Let's bring Dr. Ennis in. Dr. Ennis, many persons in rural Jamaica may be worried that they're going to be left out. And many persons think Kingston is Jamaica, but we have 14 beautiful parishes. And those persons in rural Jamaica want to know that they too will be a priority and they too will be able to get the vaccine as soon as it comes to Jamaica if they so choose. Talk to us about the rollout in rural Jamaica and the different sites and mechanisms that will be implemented so that those persons don't feel left out or are not left out at all.
We are leaving no one behind. For our rollout in the parishes, we have our designated sites, and we have chosen the sites based on mapping just to tell us exactly where persons are. So if we have our fixed sites, that would include some of the hospitals, that would be to vaccinate hospital staff within those parishes. So we have, for example, if we go to the southern region, we have a Mandeville Regional Hospital, that would be a site, a Maypen Hospital, Lionel Town Hospital. So we have those sites for persons in those regions. So they need not worry that the vaccines won't get to them or that they have to travel far. Then we look at what's happening in primary care. We also have designated health centers that will be established posts. And that's for healthcare workers. But what about the rest of persons? So the CMO mentioned persons, non-health frontline workers. We are also establishing posts at some of their facilities, some of our penal institutions, for example. So we'll be going to those persons with the vaccines. We have established our mobile teams, and once the vaccine is here and everything is in place, it's just really a get-go. So we have to understand that we are taking the vaccines to some persons and some persons are coming to us. We are also looking at the scheduling of administering the vaccines. So what are the opening hours? We're going to be holding special clinics just for vaccination, looking once we get the true burden in each parish at the district level, then we will know the days when we'll be operating, for how long we'll be dedicating those times in order to vaccinate persons. When we look at our elderly, we're not only looking at the elderly that can come to us, we are in collaboration with other entities that look at the elderly who cannot move, and we are making preparations to get to them as well. So we are trying to be as holistic as we possibly can in the reach of persons in this first phase of our vaccination program.
I'm happy you mentioned that, Dr. Ennis, very well, because I was just about to say it would be remiss of me not to ask about the disabled community, those persons who are visually impaired, those persons who are wheelchair bound. And it is so important that the sites that are going to be set up can accommodate these persons, or as you have mentioned, that the vaccine will be taken to them, because we don't want to leave out our disabled community at all. We also want them to get the necessary vaccination. Dr. Tufton, many persons have been asking about this indemnity, right? That the government has indemnified the manufacturer of AstraZeneca should anything go wrong, should anybody in Jamaica fall sick. This is not necessarily a new protocol or way of going forward. Right. However, what has the Jamaican government put in place should Jamaicans get sick or develop an adverse reaction to the vaccine?
First of all, let me just say, and the experts, Dr. Figueroa, the CMO, Dr. Ennis, have made it very clear that these are very safe vaccines, and we don't anticipate any adverse reaction except in very minimal cases. So we shouldn't put too much weight on the possibility of that. Having said that, the drug companies working through the COVAX arrangement that the WHO, World Health Organization, has coordinated, have said that the countries that are accessing the vaccines should sign an indemnity to essentially rid them of liability should anything happen. And that was the basis on which we would access the vaccine. This doesn't apply to Jamaica alone, Ms. Kitty, it applies across to all the countries. Yes. The fact is that the process of getting to a vaccine, which the WHO would have validated, as was said earlier by Dr. Figueroa, gives us the comfort that we're getting a good product, a safe product. Having said that, we recognize because of the emergency approval process why they would take this position. And what the government has done in response to that, or is doing in response, the government clearly will have to take on that responsibility. And so the Attorney General's Chamber, having gone through a process of discussion within the cabinet, would make necessary legal arrangements to meet those requirements. But at the same time, as a government, we clearly appreciate and understand that we have an obligation to our citizens. So we say to citizens, there is no need to fear. This is a safe product, as attested to by the experts. But the truth is, the government is here under universal access to ensure that those who may need additional care get additional care.
Very well, thank you so much. Let me go to the media and find out, hear from them what questions they may have. Stephen?
All right, thank you. We're going to go to Cassius Watson from Jamaica Social.
Good evening, folks. Are you hearing? Me clearly?
Yes, go ahead. Good evening.
Okay. Yes, Minister. I haven't actually seen the specifics of their situation, but I do understand that in France, they are only giving it to adults between 18 and 64. In the UK, they're giving it to all adults and the elderly. And in the UK, because they've been giving it to the elderly, age 60, 70, 80, within another few weeks,
we will know how effective the vaccine is in the elderly. Now, when you review the data for the AstraZeneca, you have to look at several things. And with the efficacy showing that the vaccine is effective is good. It's not as high as the Pfizer and the Moderna. And therefore, Switzerland may be hoping they can manage and get access to the Moderna and the Pfizer. And therefore, they may want those vaccines which have disadvantages for us, especially the Pfizer, because of the ultra cold chain that is required. With the AstraZeneca, it depends on how you analyze the data, because the efficacy runs anywhere from 60% to 80%. And when you do the modeling studies, even one dose of AstraZeneca in the population who is at risk would significantly reduce the number of COVID cases and the number of deaths. However, in the AstraZeneca trials, they enrolled the elderly fairly late in the trial, and therefore all the results have not come forward. Want to wait and see the results with sufficient that when the WHO actually completes their review next week, you will see that the AstraZeneca gets a clean bill of health and will be given emergency authorization. And it is a good, effective, safe vaccine.
And I have to do this, and I apologize for interrupting your management of the process, but Prof is a member of the expert group. Prof, I don't remember the terminology, right? I'm non-clinical, but he is part of that body that examines all of this research that is taking place at the highest possible level, not just at PAHO, but at the WHO, right, Prof? And so
yes,
when
it's
Prof,
the WHO SAGE working group on COVID vaccines. And it's a multidisciplinary team that draws experts across the entire spectrum of vaccine science and epidemiology, vaccinology, safety, ethics, and it's an international multidisciplinary team that goes into tremendous detail. This week alone, there are 3 meetings on AstraZeneca. And this is then presented to another set of independent experts called the Strategic Advisory Group of Experts, who then make a recommendation to the Director General of the World Health Organization.
I raised that point because I think it's important for Jamaicans to appreciate that the government, the Ministry of Health, the CMO, we don't take decisions in a sort of parochial way. Yes. We're not taking any decisions because we are desperate, even though we want a solution. Our decisions on technical issues when it comes to a medical prescribed or clinically prescribed approach, a vaccine, the choice of a vaccine is a function of many things, but most our expert knowledge and recommendations at the highest level that the country is not going to be placed at risk. And this is very, very important. That explanation, Prof, around the possible reasons for the delays by the Swiss and the French seems to be more a process as it is a concern around the possible harm or safety. And I think it's important because people are genuinely concerned. I mean, I've seen stories in the alternative and traditional media space challenging or questioning the decision. And I think it's important for us to overcome that because we really do need understanding so that we can advance the process in all our interests.
And that is why a town hall meeting of this nature is so important. And I'm so happy that the persons, the public, they've sent in their questions. And as intelligent people, we have to ask questions. We're not asking people to follow blindly. We want to hear the questions. And guess what? When the persons are so knowledgeable about a particular area, they won't mind the questions because they will know the requisite answers to give. So I don't want anyone to feel ashamed or shy. Don't think your question is stupid. If you have it, ask it, and the panelists are from Cuba. I will always rate Cuban medicine. I will rate them. Why we didn't take the vaccine from them?
partly a question of timing, because the clinical trials in Cuba are not yet over. So the data on which the independent experts make their judgment, the data is not yet available. We are anxiously looking forward to the results from the Cubans. Their biotechnology industry is superb. Most of the vaccines that they give to their children are produced in Cuba itself, and their immunization is superb. And I can tell you, for a range of different conditions are done in Cuba because it is done with such efficiency and done very well. Just last week, or was it this week, things are happening so fast. The results were published in the Lancet journal for the Sputnik vaccine out of Russia. And that vaccine shows a 91% efficacy. And it also appears very safe and effective. And in fact, the Russians and AstraZeneca are in discussion because their vaccines use a similar adenoviral platform. The way they do the vaccines is similar. So they're talking together. So the same thing with the vaccines being produced in India and China. We are optimistic. They're already been received in thousands of people, but the data has not come before the World Health Organization working group yet. There are also other independent regulatory bodies. The UK independent regulatory body, their experts went through the data for the AstraZeneca themselves, and they came to the conclusion to give it to their population, all adults, including elderly. So these things undergo a lot of regulatory overview and examination. As soon as the Cuban data is ready, I think it will be welcome to look at.
Wonderful. Thank you, Prof. The questions are coming in fast and furious, Prof. Because of your position that you sit, you are the person to whom the questions are being fielded. But there are many variants, Prof. And we've recently heard about the different strain from South Africa, the different variants, different mutations. Will this AstraZeneca vaccine be able to cover those variants? Because is it now that I'm going to get this AstraZeneca vaccine, but then if I'm exposed to the strain from South Africa or I'm exposed to the strain from England, then I'm still in the lurch and in the dark? How can this vaccine cover all the variants and the different mutations that are out there, which seems like is a new one every week?
This is a very important point, and there have been a number of different variants, including the South African one, as well as there's one coming out of the Amazon region in Brazil. Yes. So far, the vaccines that have been developed, the Pfizer, the Moderna, the AstraZeneca, all seem to be effective against the current variants that have emerged. The vaccines are robust, but we're going to have to monitor this very closely. The virus that causes COVID does mutate, and therefore you get new variants, but it does not mutate as rapidly as the influenza virus. So with influenza, every year a new vaccine has to be developed for the seasonal influenza that is around. We do not anticipate that it would be as bad as that, but there is the possibility that a variant may develop, and we'd have to have a new vaccine, a new coronavirus vaccine to deal with it. But as of now, and you know, in the United States, where they've given over 30 million vaccines, already they're seeing a significant decrease in the number of new cases of COVID daily. And they've only been vaccinating since January. So within literally 4 or 5 weeks, 4 weeks, it seems as if the vaccine is already beginning to slow down their surge. So the vaccines are highly effective and safe.
Thank you, sir. Let's go to the media, taking media questions.
We're going to go to Stevian Simmons from Nationwide.
Very well. Stevian?
Yes, good evening. My question is similar. Can you guys hear me?
Yes, Stevian, we can. You may go ahead.
Right. My question is similar to Ms. Kitty's question about why the government chose AstraZeneca versus the other vaccines, but I just wanted Minister Tufton to elaborate on the factors that would have led the government to make that choice, AstraZeneca versus the Pfizer and the Moderna, the other vaccines.
Right. So let me just say that we have been pursuing many options, as I said earlier in my introduction and in Parliament. However, the COVAX facility, which we signed on to as a country, one of several countries, depended to a large extent on the World Health Organization's own search for and approval of a vaccine. So, and then of course, having approved the process as explained by Prof earlier, there was the issue of availability. So the first issue is to ensure that it is safe, and then second,
reactions. You know, every time a vaccine is introduced, we have a lot of negative factors. But as we said before, Jamaica has had a very good history with immunization. All our children that are going to school receive immunization and have received several different immunizations. And we have turned out well, and we continue to do well. So I want persons not to have those fears. You know, the vaccine will work in us just as it worked in everybody else, and it won't cause us to have any harmful effects that are different from anybody else.
Very well. Prof, because some people are thinking they're going to grow an extra ear, they're going to grow like an extra leg or something, and they are fearful because they're thinking, oh my God, this is just their way to wipe out black people. And so there are persons who are of that view. Prof, what can you say to those persons to allay those fears or those concerns?
Well, the vaccine trials that took place in the United Kingdom, that took place in South Africa, that took place in Brazil. So as the CMO said, they were people from different backgrounds, different ethnicities, and different colors. But certainly black people, not only in the UK, they were in the trial, but black people in South Africa, black people in Brazil were all in the trial. And the AstraZeneca, this is the AstraZeneca vaccine I'm talking about, in all continents. And a similar vaccine has been developed in India, because there's close working between AstraZeneca and one of the Indian pharmaceutical companies, and it has also been used in India. So it's performed well, it's been safe, and it has been effective in all these populations. Many Jamaicans are too young to know or may not recall that in fact the Caribbean were the first in the world to start using measles, mumps, rubella in adults. In the early 1990s, there was a campaign in the Caribbean not only to vaccinate children, but to vaccinate adults right up to the age of 30, because we wanted to eliminate not only measles, but also rubella. And in order to do that, we had to immunize adults. And that has helped us to eliminate rubella. So immunizing adults is not new to Jamaica either. It's just that we don't do it on a regular routine basis other than influenza vaccine in those who take it.
Okay, so the vaccine is safe even for people of the Negroid race. Yeah. Yes. Minister, you could take that tagline, but I'm going to get my lawyer to call your lawyer because I can't represent myself. But let me just ask this, Minister, as Prof spoke about children and immunization of children, will children be getting this AstraZeneca vaccine as well?
All right, so I'm going to yield to the technical people to
Very
answer
well,
that, because I want to make sure that we get it right from
yes,
a clinical perspective.
So this vaccine is not approved for children. So we'll await further information. There are several vaccines that are being developed. What we have seen so far is that the vaccines have been done, the trials have been done in adults, over 16 in some groups, over 18 in some groups. So the recommendations have been for those age groups.
I will say though that and maybe this will help, just if there are fears, that in terms of the impact of COVID on children, again, the experts would have the data. It has been insignificant, unless certainly in Jamaica, the 1 or 2 cases that I know of are kids that were very ill, significant underlying conditions that were in the hospital. But generally speaking, the most vulnerable communities are persons of an older population. So I think it's a useful piece of statistics to quote.
All right, as we're about to close our town hall meeting, we want to thank all the persons. I want to thank all the members of the public who fielded their questions. I hope that this town hall meeting has helped to elucidate some of your concerns, your questions, thoughts that you may be having. And you heard from the technocrats, you heard from members of the government, you heard from professionals, you heard from persons who sit on very important and influential boards who can give the information. Because one of the problems that I have also noticed, Dr. Tufton and CMO and Prof and Dr. Ennis, is that people are getting information from the wrong people. So you're getting information from persons who are not knowledgeable, persons who are not au fait with the research or empirical data or have any knowledge at all. So when it is important to ask questions, you have to ask the right people the questions to get the learned answers. And so I was happy that we could have distilled a lot of that this evening. I will give each of you 2 minutes just to wrap up, just to say your final thoughts regarding the AstraZeneca vaccine, what you want Jamaicans to know about the vaccine, and of course the safety therein. And I will give Dr. Ennis the starting opportunity.
Thank you very much. We are confident that this vaccine is safe and efficacious. We also continue to man the advances that are taking place. And we also note that it might be one of the few vaccines in those that have been authorized for use that may have an impact on transmissibility. It's something we are watching closely, which means that the AstraZeneca vaccine has some unique properties that might be advantageous. As it stands now, we have a population of vulnerable persons, and we're working very hard on the ground to ensure that these persons are vaccinated. We have almost everything in place so that this operation will be seamless. And it is because as a health ministry with all the foot soldiers, we are confident in the process. We have sworn to do no harm, and we recognize that this is one of the benefits and another vaccine that is truly tremendous in helping to keep populations at large. We have to also be mindful that there are going to be some persons who cannot take the vaccines. And we are protecting others, we are protecting the nation, and by extension, we are contributing to protecting the world. So from us on the ground, mobilizing and getting everything into action, we want the persons we are about to vaccinate to feel assured, comforted that this vaccine is safe, it's efficacious, and we continue to provide credible information so that their fears will be allayed and they can be confident that we're actually doing the right thing.
You and your team, thank you so much for the work you do. Prof. Figueroa, what would you like to say, sir? In parting, Professor J. Peter Figueroa, head of the Caribbean Technical Advisory Group on Immunization, CTAG.
Okay, there are over 7 billion people in the world, but they're only able to produce maybe 2.2 billion doses, only 7 billion doses of this vaccine, and you need 2 doses for each person. So there is a severe shortage. All the vaccines that have been given emergency authorization are safe and they are effective. So the vaccine that we are getting, it has been closely reviewed and it is safe and effective. And as Dr. Ennis says, there is evidence to suggest that if you get this vaccine, you are less likely to pass on the virus. Because when you get vaccinated, it protects you from the disease, but it does not always protect you from becoming infected with the virus and passing it on to someone else who might be a family member, a neighbor, or a friend. So the fact that this vaccine may reduce transmission is an advantage of this vaccine. With all vaccines, with all medicines, you always have to weigh what is the benefit, what is the risk. Right now, we have scores of people getting ill, severely ill, and some dying. There have been over 2 million deaths globally. So if you weigh the advantages as against the risk, to me, it is clear it is better that we take the vaccine. And even without herd immunity, the fact that we have those who are most at risk, the health providers, the frontline essential workers, and the elderly vaccinated, it means we're going to reduce the number of severe cases. We're going to reduce the number of deaths, which is a huge advantage. I would encourage those who still have reservations, just reflect on it. Be patient with yourself, talk with persons who are knowledgeable, and seek out information from credible sources, the CDC, WHO, the Mayo Clinic, Johns Hopkins. Go to reputable sources to get your information. And I would encourage you to take the vaccine when you get the chance, because this is a chance that may protect you from illness and in some cases, even from death.
Thank you so much, sir. Thank you so much, sir. Well articulated. Thank you. And just by listening to Prof, anytime you're ready, we're ready. Stick it, please. Ready. Stephen, I'm ready. I gotta get it. In my shoulder, right here. A little cute. Right here. Dr. Bisesa Mackenzie, before we even get into your final roundup, who are the persons who will be administering the vaccines? Are you going to be training new people? How about the training? Who is going to be doing the administering and going to the different communities to interact with the citizens?
Right. So our public health nurses are the major persons that are going to be administering the vaccine, but we are training other groups, the registered nurses or midwives as well, so that we have a good cadre of persons. We intend for each parish to have at least 3 vaccination teams, fixed teams and mobile teams, so we're training enough persons so that we'll be able to facilitate that.
Wonderful. And finally, CMO, what are your final words?
Well, I would just want to say that the Ministry of Health and Wellness is committed to the safety of the population. And so the population should be reassured, feel confident that once we have approved a vaccine to be used in country, it has gone through the rigors and we feel confident that it is safe for the population. I want to make a special appeal to our healthcare professionals, because our healthcare professionals have traditionally over time, especially when we look at the take-up of the influenza vaccine, have declined to take the vaccine. And across the world, we are seeing that healthcare professionals are not taking it up as we expect. But I want to make a special appeal to our healthcare professionals in Jamaica that they take the vaccine. We have seen how this has disrupted our healthcare services. We have seen how we are putting off surgeries and other vital care. We have cut down on some of our services. We really need to get our health system back up to where it was and to now start to make advances in our delivery of healthcare. So it is important. We are prioritizing you, our healthcare professional, because we want you to be safe. We want you to be able to deliver the service to our population. And so therefore, I'm encouraging all our healthcare professionals to make sure that you are first in the line to receive the vaccine. Please, as Prof says, read the information and also be the ambassadors to your patients and everybody you come in contact with to tell them that they need to take the vaccine, and these are the reasons why. Take your information from credible sources and be confident that we are allowing a safe vaccine to be in Jamaica.
Very well. Thank you, CMO. Christopher Tufton, heavy is the head that wears the crown. And to you and your team, I know it has been a tumultuous year. It has been so many ups and downs. But I also want to congratulate you all on your efforts. We have not got everything right, but we're better than many. And so for a little island, we look about to Talawa, we're better than enough, right? There is still room for improvement, and we want to move toward that mark so that at the end of the day, Jamaica, land we love, can be safe for all of us here, and so we can invite people here and we all can be happy and we all can be healthy and well. What are your final words, sir?
Well, first of all, just sitting here listening to the three clinicians gives me a little goosebumps, if you will. I really feel proud to be a Jamaican, and I think all Jamaicans should feel proud that we have, as a small country, a small island state, the vast capacity, the footprint in clinical science that we have of our nationals. Here you have Professor Figueroa, whose reach extends to the pinnacle of public health globally and is now contributing to the safety of the world around this COVID issue. Our CMO, who has been a tower of strength, yes, and has really been technically sound in guiding the population. And beyond Jamaica's shores, we know we export health experts. I raise that point to say that if we were doing something untoward, I believe our very Jamaicans who are qualified would ball out. I'm trying to be like you a little bit, Miss Kitty, and would say, this is not good for my people.
Yes.
And there are enough of us who know enough to be able to identify when something is not right. Yeah. The truth is, the chorus that comes from this vast level of training and expertise among our own population is that this is the way to go. And this is evidenced today by the three clinicians. So I really want to use the opportunity to say to Jamaicans, your government, working with the experts, is committed to your health and wellness, to your safety. We have done so, I believe, over the past 12 months or more during this COVID challenge. And today we see a vaccine and others to come that represents, to my mind, the silver lining in solving this issue of COVID-19, or at least putting it at bay. And I really want to encourage all of Jamaica to buy in, be a part of the process, follow the instructions, because we're not doing it for ourselves, we're doing it for all of us.
Yes.
And I want to thank you, Ms. Kitty, for coming on, and your team. Thank the team at the Ministry of Health and Wellness, because it's a big team, all 16,000 or so of them across the country, another 3,000 or 4,000 in the private space. And they have done well in keeping our population safe. So thank you very much. You'll hear more about the vaccine and the take-up of the vaccine and the availability of the vaccine. And again, I say, I think every Jamaican should feel proud that we have the capacity to overcome, and we can do it with our own people. Thank you very much.
Thank you so much, Dr. Tufton, and you're most welcome. Thank you so much for having me. I'm always available. I try to play my own small part in advancing the welfare of the whole human race. This is a very critical time for our country and for our people, and we need all hands on deck. And so in whatever way I can help to disseminate the information, to have it on my radio show, to talk about it, just to bring, awareness to it, to clarify any kind of misinformation or misconception or just questions that people may have. That is why we're here. And I thank you so much for inviting me on your panel at such a very critical time. Thanks to Stephen and the entire team. It was definitely my pleasure being here. And I'd also like to thank all the other members of the panel here this evening. I want to thank the media. I'd like to also thank the public, because you guys definitely set the questions and you definitely threw them in, and I hope that we would have answered, and I hope that you're feeling you're breathing a collective sigh of relief after this town hall meeting, because in truth and in fact it's your town hall meeting. I really implore all of you to continue wearing your masks. Please remember to observe social distancing. Remember to sanitize, and please remember to not just think of yourself, but think of others. And the more we come together and fight this COVID-19 pandemic, the sooner we can all be back at the beach, be back at the river, be back at the party, eating our curry goat with white rice and a finger of banana and some manish water. And we can invite Professor Figueroa to come and party with us, okay? So please, let us just all hold strain, bun with belly, turn pan crooked and cut straight, and we will all get through this together as Jamaica, land we love. Thank you so much for joining us. Please be safe. Take care. And please remember to tune in to the Ministry of Health's website. Today is World Cancer Day, and so they're celebrating this year under the theme, I Am, I Will. And so they're going to be on at 8 o'clock, so make sure you log on, listen in, pay attention, get the information, and trust me, information and knowledge is power, and it is key. So the Ministry of Health, them are going, them have a buzz, so find them.
February is Reggae Month. Come catch the rhythm virtually. We gone online totally on Reggae Month TV. Mega reggae concerts, interesting reggae documentaries, informative reggae symposia, and lots more. Online daily from 6 p.m. to 10 p.m. on PBCJ, Jam Vision, JCDC Facebook page, and several other cable and social media platforms. Details available on the Reggae Jamaica mobile app, Reggae Month TV. Tune in daily and be entertained and informed. Reggae Month is February. February is Reggae Month. Come catch the rhythm virtually. We gone online totally on Reggae Month TV. Mega reggae concerts, interesting reggae documentaries, informative reggae symposia, and lots more. Online daily from 6 p.m. to 10 p.m. on PBCJ, Jam Vision, JCDC Facebook page, and several other cable and social media platforms. Details available on the Reggae Jamaica mobile app, Reggae Month TV. Tune in daily and be entertained and informed. Reggae Month is February. February is Reggae. We gone online totally on Reggae Month TV. Mega reggae concerts, interesting reggae documentaries, informative reggae symposia, and lots more. Online daily from 6 p.m. to 10 p.m. on PBCJ, Jam Vision, JCDC Facebook page, and several other cable and social media platforms. Details available on the Reggae Jamaica mobile app, Reggae Month TV. Tune in daily and be entertained and informed. Reggae Month is February. February is Reggae Month. Come catch the rhythm virtually. We gone online totally on Reggae Month TV. Mega reggae concerts, interesting reggae documentaries, informative reggae symposia, and lots more. Online daily from 6 p.m. to 10 p.m. on PBCJ, Jam Vision, JCDC Facebook page, and several other cable and social media platforms. Details available on the Reggae Jamaica mobile app, Reggae Month TV. Tune in daily and be entertained and informed.
Of one of our past, let the man of one of the great man. Him Sunday, him name, Alton Ellis. Give it up for Rosa, Lucky Man.
Girl, I've got a date. I just mean I can say lady, yeah.